Shalom. Welcome to the Jewish View. My name is Rabbi Nachman Simon with the Chabad House of Delmer, and we have a very, very special guest with us today, Dr. Gavin Setzen, an ENT, ear, nose, and throat doctor in the Capital District. Welcome,
Thank
doctor,
you.
to the Jewish View.
Thank you, Rabbi.
This is a good Jewish profession, a Jewish doctor with a Jewish rabbi, so we're doing all right. But on the other hand, we want to talk about some things. I mean, we can talk about a doctor, so many health-related issues, but we want to bridge the gap, and that would be Jewish bioethics. It's very interesting where sometimes that the doctors have to run into bioethical issues on life, and of course that they do, and many times that they do call in rabbis and saying, hey, Rabbi, you know, what should we do, what's ethical? So we're going to throw out some very, very interesting issues, very difficult issues, and really cutting-edge issues, because certain things are really being debated, you know, as we speak now. It's not like from ancient times, you know, what should we do? These are issues that are on the table now, and the medical staff plus the clergy have to deal with it. So let's go right to it. Maybe we can start with the beginning of life over here, and which is a very controversial issue, would be, for example, abortion, which is the beginning of life. You know, people know the basic Orthodox Jewish view. You only only can have an abortion only if it's the mother's life is dependent. You know, maybe there's a problem. Or would that be a case, for example? And
well, I think, like you say, it brings in so many difficult issues and concepts, and I think where halachically the guidelines and the principles, the context and the framework is set, the physicians are constantly challenged in terms of what constitutes the right choice and the right decision, and what's doing the right thing from a medical ethical standpoint, and particularly from a Jewish biomedical ethical standpoint. And so the abortion question certainly is a very hotly debated issue, and even in the current healthcare reform debate. But I think the primary issues are imminent threat to the health and well-being of the mother. For example, in a situation if there was an overwhelming uterine infection and the mother became septic or toxic and was potentially not expected to live unless the fetus were aborted, and where basically both the mother and the unborn child are at risk, that would constitute a medical emergency, and from a halachic standpoint also constitute a rational reason for considering an abortion. And certainly, you know, termination of pregnancy in the case of an unborn fetus who is either diagnosed in utero with some catastrophic medical condition, and there are certain conditions which may not have been diagnosed at conception or during the earlier part of the pregnancy, that might be diagnosed either due to complications in the pregnancy, or that you're beyond the early stages of the pregnancy when a spontaneous abortion might occur and there's not a viable fetus, or a significant cardiac or neurological anencephaly, and some of these other really catastrophic conditions can occur and are diagnosed late in the pregnancy potentially, and the child is not either expected to survive any duration or quality of life or even a delivery. That would be another circumstance where one would consider an early termination of the pregnancy.
you know, it's interesting. I just want to throw it out to people that are not familiar. But, you know, there's, of course, some diseases that are Jewishly genetic. Maybe they're aren't 100%, but in any case, it's much found in the Jewish. And, you know, like they always say, an ounce of prevention is worth a pound of cure. So now before, when people are getting married, they actually check their genetic makeup. Exactly, don't ask me anything about technologically how they're doing it. But I just know that they check for a lot of these Jewish diseases. Like I say, they say, oh, you're not compatible.
Sure.
And
And I think that brings up a very good point, the value or importance of counseling and keeping those things in mind, family history, and doing some of the testing. I understand that there's certainly blood work, for example, for Tay-Sachs that is generally recommended, and being able to prevent or diagnose a potential issue before it becomes a significant problem is very, very valuable.
Yeah, so, you know, because it is so traumatic in any case. I mean, we're not even getting into the psychological, you know, the depression of sometimes a woman loses a child. I mean, that, you know, we're not playing games. It's not just a little thing. So, I mean, it's an interesting issue that has to be confronted with, you know, and like that. And I think a lot of them, the ounce of prevention, genetically transmitted disease, maybe helps those, you know, so we don't have to think about those issues, and they are very difficult for a lot of people, a lot of women I know.
Absolutely.
Now, going on a little at adolescence, I say adolescence, but we deal with the swine flu, but I mean, we can fill this in. They say it's more deadly for young people. Usually they always say the old people, you know, the
Sure.
flu is for the old people, here is for the young people. You know, and of course, you know, people need vaccination, but that itself is an issue because there's not enough. Now, who gets the vaccination? You know, it's easy to say, all right, get a vaccination, you're all set. Or what if someone doesn't want? You hear a lot of that talk. Hey, leave me alone. I have so many shots, and you're putting this poison inside of me. Saying, hey, wait a minute. People are saying, you know, someone's going to get sick because you don't want to have the shot. So again, those are ethical issues. Again, going beyond medicine.
Very
We
much
have
so.
the vaccination.
And that raises, Rabbi, so many interesting points and challenges, you know, for the medical field, for patients, and from, you know, a religious Jewish perspective. How does one approach that? Because, as I'm sure you've seen, interestingly, initially the H1N1 vaccination was mandated. And if you didn't get the vaccination, you were potentially fired from your workplace as a medical professional. Now, then there was the imminent shortage, and there were some legal challenges to the requirement for vaccination, and also due to timing and lack of availability of the vaccine, those requirements changed, and it became a voluntary process based on availability. So just those logistical factors changed the discussion as well. But while most professionals were recommending the shot for younger children, pregnant women, and those at risk from, you know, immune problems, nutritional problems, respiratory issues, and things like that, the vaccination became very difficult to get, even for those patients, and that raises an ethical dilemma: who should get it, and who gets it first. So sorting out who's the most vulnerable, I think, is probably the biggest challenge, and the most important task for those who have the vaccination and are administering it. And then the issue, there's always been a lot of debate in the medical literature and the lay literature about the effect of immunization and what effect that may or may not have had on autism, for example. And here we're mandating that people get vaccinated, and raising that whole moral, ethical dilemma again. So I completely agree. The whole vaccination question just opened up a myriad of further questions and potential problems.
Well, I know in medicine, but I know in Jewish law, it's just also the same idea that one cure, then you have another problem. You know, you give
Sure.
a medicine. So, well, vaccination, we cured it. You know, well, you know, it could make other issues also. So you never know
Sure.
who's more important. Just to throw out a rabbinical kind of, from the Talmud, the issue would be of like who, you know, let's say there's two people. This is the classic question. Two people are dying of thirst. There's one flask of water, enough for one person. Who gets it? One guy said, well, you know, it's mine. And if I give it to you, you know, I'm going to die. So, you know, because you're always talking about saving a life. It's so
Yes.
important in Judaism. It's the most important thing in the world. And in any case, that so that's a big dilemma. And they usually say, well, your life comes first. You know, you have to take care of yourself. And maybe that deals with vaccinations, the different issues over here, which we'll talk about. But it's an interesting idea. On the other hand, there's another Gemara that it says that, you say, well, I always come first over here. I mean, well, that's too simplistic. Because what if someone, in not a medical issue or an idea, is that someone comes over to you and, and says, mafia guy or something, some crazy situation, but whatever, that's the situation. You kill him or I'm going to kill you. You got to knock that guy off. Well, better he should die than me.
Right.
No, that's not the Torah attitude. And the better you should die, you have no right to go out and kill somebody else. So these are two major ideas. It's just say your life comes first no matter what. You cannot make those kind of statements. But I think it applies to the medical profession also. You say, well, hey, take care of me. What the heck do I care if a few people die? Just get me the vaccination. I'm not worrying about them. Listen, you got to take care of somebody else too. But it's a touchy subject. That's what I'm saying. It's something that, you have to, who's the most important people to live. I mean, it could be a situation of life and death.
And it's interesting when you mention that, when the H1N1 vaccine was mandated, a lot of people were up in arms, why should I have to get the vaccine? Then when the mandate was lifted and there was no availability of vaccine, then patients were calling constantly saying, when am I going to get it? Why can't I get it? And when is it available?
Yeah.
So there's some interesting sociological dynamics, I think, as well, and being able to blend the halachic and medical aspects, I think, helps keep one on the right side of a good decision that's moral and ethical and safe.
Yeah. Oh, it's an important issue also. I mean, that they always throw that out in medical ethics. I know that also, there's an emergency, like maybe, we had in the United States a Katrina, where, hundreds of people all of a sudden in one area, one city, have emergency care now. I don't know how many beds there are in the capital district. God forbid, we shouldn't even know from these things. But these are issues over here. There's just limited amount of medical staff. I mean, for a normal day, fine. Everybody a broken leg here and a heart attack there. The hospitals can take care of the situation. But, we have seen, Katrinas and floods and hurricanes, and all of a sudden, what if you have a few hundred people and they have to all get to the emergency room? There's just no way that these medical staff is able to, have the beds and the medical equipment take care of them. So that's a very big issue. I mean, that's thrown out.
I agree, and I think that opens up so many challenges and problems, mass casualty or mass medical need situations. And ironically, I don't think parts of the U.S. and certainly in the Katrina situation were not adequately prepared for that. And one of the head and neck surgeons from our academy was intimately involved in the Katrina situation and was one of the people who was actually charged by the Attorney General for issues relating to consent and treatment and denial of treatment and things like that. And it raised a myriad of issues. What happens in a situation where you're in a hospital and people ordinarily are going to come to the hospital as a place of refuge, but you don't have enough medical supplies, running water or electricity to take care of the people in the hospital. Do you turn those people away? Then how do you decide who gets the care in the hospital? People who are very elderly, very ill, and are not expected to survive, people in the intensive care unit. How do you ration the care that is available? What happens to a regular consent form? When a patient signed a consent form for care, that changes dramatically in the case of a natural disaster or a mass casualty situation. And all these doctors and nurses who were making what in their mind and training and from a religious point of view were ethical decisions and choices were actually sued after the fact for having made those choices. And it required, I think it was about 2 years of intensive legal negotiation, changing the legislation in Louisiana, and subsequent development of a national task force to develop guidelines. And one example where that has current relevance is if the H1N1 situation became epidemic and, God forbid, many people required intensive care, hospitalizations, or ventilators. What are the criteria for deciding who gets a ventilator in a limited resource situation? And so they've had panels of medical specialists, clergy, bioethicists, sociologists, psychiatrists, lawyers, and others working on these issues for probably literally since Katrina, developing what might be guidelines that can be implemented in a situation like that.
Yeah, again, just we said at the beginning of the show, but it's so important that, you think sometimes rabbinical literature, oh, they're dealing with ancient, even though I did bring up a few Talmudic statements, and that itself is interesting because these are, universal ideas, we didn't come up with them. We're not the first ones to think about it, but it is right now, that's what I'm saying, very much contemporary issues, and it's just interesting, for me as a rabbinical idea, that, that you have ancient texts, and they're saying, hey, they're talking about issues today also, you can relate them. Of course, they didn't know from swine flus,
Sure.
And things like that. But, well, a disease is a disease. Obviously, they had other diseases, and just also amazing, really, we can get into also there are new diseases today that, I always tell everybody I'm 29 years old. Don't look at my passport too much. But, when we're younger, you think, oh, we're going to wipe out disease. And there's the next thing is I was saying AIDS, which is a very, hot topic, because then it's a matter also of how much money you put in research.
Absolutely.
And I know a few people, again, I'm not a medical person, I never said I was, but as a rabbi and they come to us, almost like when they lose being a doctor,
Sure.
Doctor, help me, and then the doctor says, well, we don't have anything for you, rabbi, help me. Do something, at least pray, do something, get some divine intervention. And of course, we try to get in, but the issue is just that certain people have disease. Well, there's not a cure for them. They're not looking for a cure because there's only a few people with those, diseases where, if you have a normal disease,
Sure.
nothing normal, God forbid, I'm not saying, but, whatever, that so many people have it, there's been millions and millions of dollars and funds and, all kinds of money and foundations to help them. So that itself is an issue, who's important. Because 1,000 people have the disease, it's important. If 5 people have, it's not important to. But again, there's a limited amount of doctors researching and a limited amount of money also.
No doubt, no doubt. And you actually raised an interesting point where a patient will potentially go to their physician, but also their rabbi. I think that is so important because faith and hope and trust and the notion that things will get better, I think, are critical to just a general sense of well-being and outlook on life, but are so important to helping somebody recover and stay healthy. And I think that is something that's oftentimes lacking in patients, or, where you take away a patient's hope and say, is that ethical to say, well, there's absolutely nothing I can do. Thank you very much. Try somewhere else. Not that you should give a patient a completely false sense of hope, but never to really take away all of a patient's hope when that's all they have left. And that's important, a comment that you made, to be able to nurture and try and maintain the inner strength as well. But then, relating to HIV and some of the other conditions, maybe also we spend so much resources in medicine on treating certain diseases. It makes me think also that the preventive aspect, I think, is so important as well. And in terms of education, whether it's HIV or obesity or some of the other lifestyle diseases, alcoholism or addiction or whatever, education and putting resources into that. You mentioned an ounce of prevention, I think, is so important going forward, and I think brings in a lot of the halachic issues and would be a very good step in the right direction today.
I know it's important. That's really where I'm coming from, even though, again, I'd say I'm not a doctor. I don't prescribe medicine, I don't give any medicines. But on the other hand, from that aspect, you know, there is a vital idea in helping people and keeping their spirits up. You know, on the other hand, that you know, someone came to me recently and they were smoking cigarettes for 50 years since they were a 9-year-old kid, don't ask. They said this to me. And in the meantime, it caught up to him, so now he's got some real diseases over here. They're terrible. And of course, you know, every person, he's fighting for his life. You know, and the doctor says, well, what do you want from you? You know, you've been smoking, what do you expect? He says, well, I feel, you know, come on, you know, all right, I did something wrong, but, you know, and he did quit. You know, I mean, his life was on the line. But, you know, he felt that, again, that encouragement was important. And he didn't feel that this doctor gave him encouragement like, oh, it's your fault anyway. Or a lot of times, you know, people say, well, you're overweight. You know, what do you want? You're a heart attack. You know, you're way overweight. You know, all right, maybe I am, but no. You know, let me, you know, I don't want to give up so fast. All right, I made a big mistake my whole life, but, you know, so there goes both issues. You know, I know that you're right. I mean, that's what they always say, a little exercise, a little bit, not a little, probably a lot of exercise, you know, smoking. And these things are so important, like you say, now it's prevention. But, you know, the spirit is really that important too also. A little bit, that's a little bit the spirituality that, you know, again, using, you know, Hasidic rabbi, we use the Kabbalah and the more emphasis on spirituality. And my sister is actually a doctor in Pittsburgh, oncologist, and, you know, that's really life-threatening to say the least. And she, you know, to tell you the truth, she's not the most religious, like, really not like myself. And she just says, you know, just almost like from a secular point of view, from a medical point of view, she says when patients start saying, oh, it's all over, she says, oh, you know, I'm telling you, I mean, I do what I can, she says, medically, but I know those people are going to go fast. And someone who's fighting it, you know, just has a positive attitude, we're going to get through this, you know, and they have better chances, you know, and, you know, she tries to tell them, I mean, she's a doctor and she's not the rabbi either, you know, but on the other hand, there is this idea of spirit over, you know, the body that control it over certain things.
And I think that's a Jewish. It's almost innate that there's always that will to persevere and survive and beat whatever the situation or the condition is. And something occurred to me. You know, you were saying when you know, physicians, I think, may not always think about it, but most physicians ultimately become patients, and I think the physician-patient relationship is so important that physicians need to be respectful of patients, sensitive to how they might interpret things. So telling somebody, well, you know, you brought this on yourself, or you're grossly overweight, or, well, you smoked, what do you expect? I don't think does anything to help that person, you know, facilitate a better, healthier lifestyle or recovery or outcome. So while it's important to change the behavior, it's also important to nurture the doctor-patient relationship and make sure that that person feels good about going forward doing what they need to do.
With the right things. Well, that's a lot. You're right. That's a very Jewish attitude, you know. And people say, how can the Jewish people survive 2,000 years of persecution? Well, you don't sit there and lick your wounds. You just keep moving, you know. Well, it is what it is, and, you know, this is the situation you have, and just keep on moving. That's really a very Jewish thing. You know, I just want to, we only have a few minutes, but just even the medical profession, and everybody, you know, Jewish doctor, everybody knows about it, but just from the Rebbe advised somebody, really was an audiologist in the end, but all right, it's like the medical profession, I don't think it was an MD, but the Rebbe told him that even though certain things, you know, from a rabbinical and a Jewish, you know, a classic Jewish standpoint weren't, so to speak, the best thing for Jewish people to get into because of different, more like philosophies, you know, Greek philosophies that they talk about in the Mishnah. He says the rabbis never banned medicine. You know, medicine was always something that, even though it was quote-unquote secular, I mean, it's not religious, it was secular, but that was never banned as, you know, like forbidden. But they didn't have so many fields that they had, you know, 2,000 years ago. Now there's so many fields about everything, you know, but usually it was a philosophy about life, but you could say the liberal arts, or it was, you know, a few things as medicine. And, you know, again, I mean, that medicine was something to help people, which of course is one of the highest levels of, Jewish practice. I mean, like I quoted it, to save one life, to create, saving a whole world. And how many people could really say that in their lifetime? But a lot of times, the right medical care, people say, well, he saved, give him the right medicine, or he took care of me, or, I say also, I try to say, to give him hope, saying, well, we'll get through this and we'll give you the right thing. So it's very important that even in the positive sense, there's a lot of overlap, not that every doctor has to be a rabbi, and not every rabbi is a doctor, and like that. But there are overlaps. That's what we want to bring out in today's show, that it's important that people can see that there is connection. I mean, we always say, Torah people think, oh, religious, kosher, and, Rosh Hashanah, the high holidays. But, in Judaism, they can relate to these ethical questions, which, like I say, are very much cutting edge, and that people are dealing with now, and these are, tough choices. And people with the money also, like I say, should we give it to the AIDS Foundation? Should we give it to the heart, to the lung, to the, there's so many. And those are real issues, because there's never enough money to go around for everything. Can't have everything. So these are, hard questions. Do we do it on severeness of the illness, or should we do it in the numbers, pure numbers, how many people have the disease?
Absolutely. And interestingly, one always still comes back to the halachic teachings and things that are thousands of years old in helping us make decisions today. So for the most complex, current, contemporary problem or deliberation, it's still our guiding principles that help us ultimately, as Jews, make those choices and hopefully better decisions.
No, it's excellent, because ultimately you have the total reverse of everything we're talking about. And there's books written about the Nazi doctors. They use medicine for their crazy experiments, use human beings as guinea pigs. So again, like you're right, using Jewish moral ethics is, is a guiding point for medicine. Well, we're out of time. We had such a good time with Dr. Setzen. And hopefully we come back soon over here and we talk about, there's so many interesting ideas. Well, thank you very much for being on the
Thank you very
Jewish
much,
Show.
Rabbi. Appreciate it. Thank you.
Shalom, welcome to the Jewish View. My name is Rabbi Nachman Simon with the Chabad House of Delmer. We have a very, very special guest with us today, Dr. Gavin Setzen, ENT, ear, nose, and throat doctor in the Capital District. Dr. Setzen, welcome to the Jewish View.
Thank you very much, Rabbi. Pleasure to be here.
Well, this is our part two. This is our second show, but you'll find it very interesting. We talked about Jewish bioethics, or really it's bioethics, but of course I'm a rabbi, so I'm going to put it the Jewish aspects over here. I mean, ethics is a real issue nowadays. It's not like you say, well, something ancient, well, you're digging up something from an ancient Talmud. Well, we do dig up things from the ancient Talmud, but you'll see how relevant they really are, these issues, to cutting edge ideas that are happening right now. One of the ideas, of course, is birth. Now, of course, everyone knows how a baby is born. We have to use this show for that. But in any case, everything seems simple, but it's not so simple. And I was astounded, and I don't know how many people know this. I figure how many people can't have children. And, you would ask me, this number of years ago, I said 2, 3, there's always 1 or 2%. And I found out it was like 15%. And it's a lot. It's like 1 out of 7 who want, obviously if you don't want, you don't want. But people who want children and they can't have. So, and, a lot of times, it goes the other side, oh, there's too many children in the world, but for that couple who want children, it's an incredible problem. It's like good and less people in the world. Well, not for that, whether we won't get into that whole issue, but for that couple, I know that it's a very, very big issue, you know, not having children, but that's where medical science comes into play, and it's practically miraculous, you know, what medical science can do nowadays over here. I mean, you can say that for a lot of the science in the world around with the computers, but et cetera, but they are working on it because it is a real issue. So maybe explain that, and maybe we'll throw out some of the issues that are involved with it.
Sure, and I'm sure, you know, just you know, in its basic essence, the family who is incomplete without a child, what impact that has on the immediate dynamics within that family and the extended family, and what a potential problem that could present. And then it raises the issues of potentially, for example, hormonal therapy. And with that comes the discussion about multiple pregnancies and the incidence of twins or triplets or quads, or, you know, greater number of pregnancies based on hormonal therapy. That has its own moral issue with respect to the health and safety of each individual fetus, and with a much larger number of live pregnancies at the time, that obviously becomes an issue in question. And then I think, you know, halakhically, what the standpoint with respect to in vitro fertilization, and that over the years has become a very sophisticated, evolved process as an alternative to, you know, hormonal therapy and things like that, in vitro fertilization. And while it's halakhically permissible, we saw recently the birth of eight you know, viable fetuses, and what impact that has for that family, for potentially what was an unmarried mom who was not really in a position to support the children, and so the impact on the family, the healthcare system, the community, and every step along the way. I think there are so many psychological, social, and practical issues that